excited for us to be talking about a very important and I think a very critical topic, mental health, psychiatric care. And I'm very happy to have Dr. Palesa Nondabula from Bloemfontein, South Africa, here with us to be able to share and psychoeducate on information regarding her work. Palesa, Dr. Nondabula, welcome.
Thank you, Melebu.
It's lovely to have you in the Mountain Kingdom.
Thank you. I'm excited to be here.
Thank you. Thank you, Ma'am. Just before we start, I think our audience would love to know who Dr. Nondabula is, probably who Palesa is, and who Dr. Nondabula is also. Just the work that you do as a psychiatrist in mental health generally.
Thank you. I am super excited to be here. Thank you so much for having me. Sorry. Palesa. It's a Mosotho girl, actually. Shocking than the surname.
I know.
I remember one of our colleague working with you here in Lesotho when we had a meeting. She was saying, could we please accommodate Dr. Nondabula? She may not understand Sesotho. Oh, Basotho ba heso ke Mosotho, Sotho. Atswa kwana Thabazeka, mabuluka ha morena bereng ke mohlakwana ka seboko. Kampa ka inyalwa kwana Maxhoseng kwana. Hence the surname.
Oh yes.
Yes. So I am a psychiatrist in South Africa, working both in state and private. And private has just started, but I'm excited about this milestone in life.
That's really exciting.
Thank you.
Yes, and I'm sure it'll be interesting just to hear about your journey, because it's so encouraging. It can be very difficult even for people just to start in private practice or in any other area of their lives. So it's really good just to hear your journey. And I would also like to say welcome back home.
I'm honored. Thank you.
Welcome back to the Mountain Kingdom. It's really lovely to have you. And we are grateful because we really don't have a lot of psychiatrists in the country. We've had here and there visiting doctors. We used to have Dr. Dennis, who was based at Masiro Private, which is one of our private hospitals.
All right.
We do have doctors that work in mental health in one of our psychiatric facilities here. But in terms, when you look at the population, even just with psychologists in the country, it's really a handful of people which really doesn't meet the need of the population. So it will be good just to have awareness, resources. I know a lot of us who drive to Bloemfontein. It's just 2 hours away. It's really a good opportunity for them just to be aware in terms of what is it, in terms of resources. If I don't get help here in the Mountain Kingdom, what can be the other options as I go out, for example, in South Africa? We're used to going out, Bloemfontein, yes, maybe 2 hours away, but I know a lot of us have been going to see you. And I'm wondering, what are some of the presenting conditions that you usually see in your world of work? What has the experience been generally?
Thank you for that question, Melebu. We see a range of illnesses, but let me start here. In terms of accommodating the Basotho people, we are very open. And the fact that we are having this conversation, it takes this whole mental health care thing and collaboration a step further, offering services. When usually people would have seen you or would be seeing one of your colleagues, or the physicians will be referring the patients to us, having sensed the need for mental health care, like pharmacologically. You offer the psychological services, and we offer both the psychological, but mainly the pharmacological, which is the medication. So the most patients that we see will be the mostly the depression, the mood symptoms, the bipolars, and the substances. It's very rife, and it's something that we don't talk about it very often. The psychotic ones, it becomes difficult to transport them. That's why we see them less.
Yeah.
And it's a challenging for our colleagues here to refer a psychotic patient, unless if the family themselves can find a way of taking the patient to South Africa. But then traveling, remember the 2-hour travel with somebody who's psychotic in the car, it's challenging.
It is.
Yeah, so it's better if they see maybe a physician who can give them something to be calm.
Sedate,
yes, to sedate them and be calm, then they can be transported. In terms of the services we offer outpatient consultations. And on this one, I just want to bring clarity that our tariffs in South Africa are quite high. But the Basotho people need to know that we do accommodate them in terms of the charges and the cash, or even their medical aid tariffs as compared to the South African tariffs are a bit lower. We accommodate those.
It's good to know that, because we know that the standard of living, the GDP, it's just not the same in South Africa as in Lesotho.
It's not.
So that's very important information, because somebody may stay away thinking
it's
I may not be able to afford it. Exactly.
Yeah. So they need to know. I just wanted to put that information across, because most people think I cannot access the services in South Africa because of the expenses and but the tariffs, truly speaking, they are adjustable. We adjust them based on what your medical aids will offer and the affordability as well, cash-wise. We also offer them admissions. In our hospitals. We have I see sorry.
Okay.
I see a lot of Basotho, and my colleagues as well see a lot of Basotho patients, and we admit, though the South African admission terms, the medical aid will cover 14 days to 21 days. The Lesotho one is usually around 7 days, maximum 14 days in severe cases. Yes, unless if the family can also top up if the patient is still not well, and then you can get into an arrangement with the facility. They usually want a 50% before admission. They accommodate them, really, truly speaking.
And I think it's very important just for everyone just to be aware of, for example, with my medical aid, what is it that is offering in terms of hospitalization? What is it is offering auxiliary in terms of outpatient? We always say it's the responsibility of the patient or the client to be able to find out, because sometimes, like I said earlier, we shy away not knowing that there can be help out there, especially because in mental health or in any other illness, sometimes crisis strikes and we don't even know where to start. We don't have, and we hope that this information will be able to just prepare patients to be able to say, in a situation like this, when there's a crisis, when we have an immediate breakdown or psychotic episode, what is it that we do? So it's very important.
Sometimes a client from South Africa, from Lesotho, may not have a psychiatrist already, but if crisis strikes, they can present to speak to their medical aid, they present to the emergency services department, and then there's always a psychiatrist on call. Then that psychiatrist will come and see the patient, and then a decision will be made whether this patient is admitted or not. But at least there will be a 24-hour holding to stabilize the patient.
Oh, yes.
Then a decision can be made after that.
Okay.
Yeah.
It's good to know that and have all that information. I think it will be very useful. Now, in terms of presenting issues, you talked about depression, you talked about substance, and of course, in your case, in a clinical setting, you also tend to see a lot of, like we said, psychotic presentation. As a patient, in terms of care, and I know a lot of times people think, oh, medication. Once, for example, I'm going through a depressive episode and there's need for medication, I feel like defeated. Am I really going to start taking mental health medication? Does that really mean I'm a mad person? What does that even mean? And the language is very important because I think even just generally the public, we don't even know how to handle family members because we don't have any information. How do I deal with them? Are they orientated to space, time, and people around them? When they're not, how do I handle them? Still with care, still with respect. And I think later on it will be good just to look at the care of the carers because that is also very important.
Taxing.
Exactly. But before we get there, as a patient thinking medication, how can people readjust and understand the need for psychopharmacology, the medication, like you said earlier, without feeling like I'm defeated? Because I can take Panado and pop it up without even thinking, and yet when I have to take Wellbutrin, for example, I feel like, why should I be? It's a very difficult journey to transition. What do you say to your patients in a situation like that?
Melebo, the question you are asking, it's a very pertinent question that always sits on my mind. The stigma that mental health has received has robbed people of care and wellness and maintaining or preserving their function. Whereas if they could have started treatment without this narrative and stigma, they could have very well been well people, functioning, maintaining their jobs, maintaining their families, just be on medication. What am I saying? Why is it a diabetic patient, a hypertensive patient, an HIV positive patient, they can take their medication and not be ostracized because this one has got diabetes? What's so wrong about mental health? As an organ, the head is an organ attached to that body. So why should it be an exception? The same as HIV. I have a background of HIV specialist. I always say to my patients, if this is the pill that the diabetic gets, the hypertensive patient, if they can take their medication every day to maintain their blood pressure, why can you not take your own medication to maintain your own mental health, your sanity, your mood, which is a normal illness, like hypertension and diabetes. And for the diabetic and the hypertensive person to maintain living and not having a stroke, they need to have their medication. The diabetic, for them not to go blind and have kidney failure, they need to take their medication and their injection if they are on an injection.
That is true.
For you, who has depression, who has mood disorder, who is psychotic, what sets you apart that you cannot take your treatment the same way that the hypertensive person does. And knowing this, it's my appeal that you don't have to be labeled a psycho, a mentally, a whatever. It is okay not to be okay.
Oh, yes. Yeah.
It is acceptable not to feel good. It is okay to take your medication in order to lift yourself up, in order to preserve your function and to maintain your livelihood.
And we really hope that conversations such as this will help in terms of continuing to break the stigma. I must say, unlike back in the days, I find that even Basotho, even internationally, people are starting to really advance, and like you're saying, to say it's okay to not be okay and take care of ourselves. But we must be honest and practical. There's still a lot of stigma around mental health.
There is.
Especially even just around taking medication.
There is.
So we need to start demystifying and realizing that treatment, early treatment for that matter, and care goes a long way in preventative work. So that is very important.
Very important.
Yeah.
Very important.
Yeah.
Because the earlier you take your treatment, stay on it. And the tendency is that when people gets better, they stop medication. There are certain type of depression that are episodic because you are going through a life stressor, a challenging situation, severe bereavement, you've lost somebody very important, you are finding it hard to deal with, and just to pick you up, we can give you medication for 6 months for the first episode of depression, or 12 months.
Yeah.
And then we can stop once you are okay and you are functioning better. Should you have a second episode later on in life or another episode, then we will advise you based on the trajectory of the depression, multiple episode. Every time you have an episode, any other mental illness, but I'm just taking depression as an example. If you have had more than one episode, you do not return to your baseline. So there is a certain neuronal loss that is, in simple terms, your function declines. Your brain wellness, it's a decline. I don't want to use medical terms that people will not understand. So advisably, we recommend that you take treatment for lifetime as a preventative measure, as a preservative of function and cognition, your brain function. And it's just one pill.
Oh, yes.
If you can take it correctly and you stay healthy. For yourself, for the people around you.
Very important.
And the world is going through such a difficult economic period. We cannot afford to have people who are not functioning because of mental health that could have been prevented to get to that point. And it costs the country.
Exactly.
If the workforce becomes ill mentally and they do not get back to work, that's a loss of skill, of service.
Oh, yes.
Again, now that they cannot finance their own medical care, they become the country's burden.
Oh, yeah.
So to safeguard all this, we suggest that people should take medication, stay well.
Oh, yes. Yes, and I think it's very important to highlight that you can't take yourself off medication. It's very important. You always have to, despite the side effects that may come along, it's very important to always go back to your clinician to be able to say, this is how I'm experiencing this. Then you have an opportunity for them to explore different options looking at your medical history. So that is very important. And also, I know even when you said medication lifelong, someone may think, oh, am I going to be taking this medication for the rest of my life? I think the way that you explained it, when we fully understand the benefit and the why, then it becomes easy. It will take adjustment, but then it becomes a little bit easier to be able to say, what is it that I can do to be able to adjust, understand the importance of that. If it's to maintain my overall health and functioning and I need that, then why not? Just like you're talking about all these other chronic illnesses. So very important, and I think it's okay to not be okay.
It's okay.
It's okay to take my medication to feel better, just like I would to take a Panado to be able to. Exactly. Yes, we should be able to learn and to adjust accordingly. Now, I just want to touch a little bit. We talked about stigma. Sometimes there can be shame that comes with, for example, the awareness that I went through a psychotic episode. I lost touch with reality. I lost control. I behave in a way that when I hear stories that I've been told, that can bring a lot of shame and embarrassment. And it can be very difficult. I know that in a multidisciplinary team, for example, you would have a psychiatrist in terms of medication and treatment, psychologist in terms of psychotherapy, you will have your psych nurse. We all work together. Environment at home, your social workers play a role in that. So when it comes to now holistic care and thinking of that shame and stigma, we usually talk about Brené Brown. You probably know her, one of the researchers who works a lot with shame and vulnerability. How does one come back, for example, from that? It's part of treatment, it's part of the healing journey. In your experience, what are even some of the issues that the patients battle with? But I feel like at the core of it is shame. Yes. How do
or sometimes guilt if they had done some things that have hurt other people.
Yes.
Yeah.
How do I come back as a patient from that? In terms of care, what are your recommendations in terms of your sphere, even in terms of referral?
First, Melebo, mental health is a stigmatized thing. Being a stigmatized condition, the things that happened when we are not taking care, they are this that we end up causing, bringing shame to ourselves and others. But the thing is, you were not well. That's where it starts.
Yeah.
You were not well. We need to understand that. And we prepare the patient that as much as you were not well, this is what transpired. And you are still going to face this when you go out. And you have to be mentally prepared to either confront this, face the people maybe that you have hurt, apologize. We speak to family if you have caused grief or overspent on the money or did some things, broke the house down. We call the family in. We also psychoeducate them that when this person is ill, they lose touch with reality. A child may, let me take it, for example, somebody who was psychotic, who has had voices or they're commanding and all that, and they had seen a child as a tokoloshi, and they have done something to that child in order to safeguard them. They feel threatened. It's not that they have malicious intent. They feel threatened. At that time, they're just trying to survive, protecting themselves. And they're not in touch with reality, like we said. So we need to understand this component, so that we can have compassion towards what had happened, what they have done, and we need to forgive, accommodate. As a society, when we understand such things, then it will be easier for you to reintegrate into society, because you are not being looked through the binoculars of the actions you did when you were not well. First, you have to forgive yourself, because if you are guilty laden and you are feeling shameful, then it will be difficult to face the world and the people that you have hurt, or the community. So when you have forgiven yourself, you have understood that for every action there is consequences, you know, and this particular action has caused these consequences. And as much as I was not well, but however, I have to face them. And you approach the people that we have hurt. And if it's a family member, and if it's the community, then we engage the social worker to reach out before we can release you into the community for your safety and for your family safety as well. Because the community can still be very angry with what you have done, but the social worker will lay the ground and do the groundwork and explain, and then integration happens.
I like the links through the transition and the integration journey, because it involves everyone. And it's very important. But at the core of it is about understanding. Because when I have a full understanding why this particular neighbor or family member behaved in a certain way,
of bewitching them.
Exactly. Then I fully understand that. And as long as we can adjust and transition that this is a patient, this person is ill, they are not themselves, they're experiencing hallucinations, whether visual or auditory, or, you know, when we have understanding.
And these voices, Melebu, in their heads, they are very real.
Oh, yes.
They are very real. That this man is bewitching me, and he's looking, the moment he looks at me, he has bad intentions, and I can hear what he's thinking. You have no powers to know what the other person is thinking. It's just that simple as that. The person is out of reality, in touch with reality. So when we understand that, we become more accommodating.
It's very important. And like we said earlier, the burden can be so heavy for care, because as somebody caring for a family member who is out of touch of reality, it can be very challenging, especially when you don't have psychological resources, the knowledge, finances. There's a whole of, you know, contributing factors to all of that. How do carers care for themselves? How do they care for others? I always say it's very important to put the oxygen mask on ourselves first before we can, you know,
help others.
But it can be very challenging, especially because most of the conditions will present in a crisis, unexpected even times. What do you say to family members, to communities that are caring for people with mental health illness?
Thank you so much, Melebo, for that question. Can I start it at this point? That families usually, especially in our Black culture, they delay patients in seeking help because they would look for other sources or other reasons, like witchcraft, bewitching and all that, and then they will take them to the traditional healers. The problem, it's not resolving, and by the time the patient comes, it's already even late to intervene, to get them back to baseline where they were. But I always say not to undermine our people, to satisfy yourself for your family member. If you believe in traditional healers, for the first time, go by all means, go and consult the traditional healers. But if this does not work, please have the courage to consult the Western medication, because now you have done the traditional, you have slaughtered a cow or a chicken to appease the ancestors, but this is not going meriting. Then it will be wise to seek for professional help. And with that said, medication is key. And to maintain that, the family can be really, 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 really financially, psychologically, emotionally. It's daunting, it's exhausting to look after somebody like that. So I don't know how you do it in Lesotho, but in South Africa, we will have the family, we say it's a high expressed emotions. Sometimes they think, why get this? It's not because wakula. Why get this? So forbearance, tolerance, support. It goes a long way because it doesn't evoke that much emotions in you and stress and anger towards this person. So you in that way, when you treat it like that, then you are not so stressed. And we even call them for the family therapy to support them. Sometimes then we find out that even the other family members, they are struggling emotionally. And then when you address that, even the care to this particular patient in terms of relapses and future illnesses, it becomes even better because the person who's looking after this person is mentally and psychologically healthy themselves. So when you are stressed, you are going to have, it's transference. How do I say it in simple? My maikutlo a fapaneng a bohloko towards nna ke kulang. And because you are having this transference towards the person who's ill, the likelihood of that person being well, it's very low. The outcomes are very poor when there is no support and you yourself, you are not well. So it's important to take care of yourself as a carer. Come forward if you are struggling. Sometimes the patient will need some admission so that you can have a break. And then we psychoeducate you as well before we release the patient to you that this is what needs to happen. This is what you need to be on the lookout. Once the patient starts acting like this, signs of relapse, in other words. So notice it before it gets to a full-blown illness of either psychosis or depression or mania. Then you can bring the patient earlier so that it doesn't cause too much stress on you. Then we can help her.
Earlier intervention and awareness is very important, not just for the carers, but I think as a patient also, because if I've had the first time, yes, it may have taken me by surprise, but then looking back, I'll know that for me,
once this happens,
exactly, there's always those red flags that will start showing when you start. The body always tells us, there's always a bell, even just with the simple word, fatigue. We shut it down with Red Bulls, for example, when we're supposed to be resting, until literally I crash or go through a burnout. So it's exactly the same thing. I really appreciate it when you say, look for warning signs ahead of time.
And seek help.
Seek help. Healthy boundaries. Be able and give yourself permission to be able to step back when you feel you can't take it anymore. It's very important and it's okay. Because otherwise we try to help and do more damage when we don't have capacity.
You can't pour from an empty glass.
You can't.
You can't pour. This phrase simply means that when you are a container yourself. You contain your own emotions and the health of the person you are looking after. If you are empty in a sense that you are not well, you are exhausted, you have burnout. Carer burnout is very common. And if there are no other family members who are sharing the burden with you, then the healthcare workers should be your next best ally and support, where when you are feeling, I cannot do this at this point, you approach the usual people that you usually consult, or you go to the hospital, you take the patient to the hospital, and you say, it's okay, say it. I am tired. I am exhausted of looking after this person. He makes me upset. Sometimes I cannot contain my emotions. Sometimes I become enraged. Say it so that we know how you feel and how to support you.
Yeah.
It's very important. Say it.
It is.
Look for help for yourself. Express your own emotions, even the ones that you feel towards the patient.
Yes.
Say it so that we know how to support you. Or when the patient is at their best, we can psycho-educate them on things that they are doing that actually pushes you to the end as a caregiver.
Yeah, that is very important. It's really part of holistic care instead of just focusing on the patient, because the illness does affect all of us.
Family.
Exactly.
Yeah.
That's very
the
important.
Community as well.
Yeah. That is really, I think, I like it when you kept saying, say it, because it gives us permission to be able to deal with our own issues as part of the healing process. So as part of your parting words, because this has really been very informative, I know it's a very difficult topic to talk about, but as part of your parting words that you can encourage Basotho and people all over South Africa and internationally, as a psychiatrist, what is your one message that you'd like to say, whether to your patients or to the public in general, in terms of mental health, psychiatric care, and the importance of seeking help?
There is no help outside mental health. Everything starts here. If you are not well here, this will not be well. When you are not at your best psychologically, mentally, even your physical crumbles. And most people don't know that, don't understand it. For example, when you are tired, you make poor decisions, you become irritable. That should say a lot.
Yes.
So when we look after our mental health, there is no shame in looking for help, seeking help for your mental wellness. Because all health starts here, mentally. And let's go out, consult. Even with the personal issues, your marriage, you may not have a mental illness yourself, but your family member, your child, your grandmother, and our grandmothers. This is something I wanted to touch. Our grandmothers who are getting demented. They can wake up and walk out of the house without clothes, and because she's not very aware of what is happening. And then she's caught on the next street, and then she's accused of being a witch. It's simply dementia.
Exactly.
And when we know things, then we act better.
Oh yes.
Let's look after ourselves. Once a year, consult a psychologist. You don't have to come to a psychiatrist. It's a bigger one than you are not well. But everybody, once in their lifetime, they should have seen a psychologist. The world is demanding so much. Life is so hard. It's so costly. We can't afford so many things. Our children are using substances. Even if yourself, you are not well, but the circumstances that surround you drives you to not feeling well, to be exhausted. look for help and look after yourself.
Well, you've had it. There's no health without mental health. We do hope that this podcast has been very informative. Feel free to ask more questions, drop your questions, your comments, subscribe, follow, and share, because you never know who will need this information. Until next time, thank you for your time and thank you for listening. Thank you, Dr. Nondabula.
Congratulations, Melebo, for this podcast.
Thank you, Mel.
It's a huge step in this country.
It. We really hope that it will psychoeducate Basotho and everyone.
Thank you.
Thank you. Until next time.